Good afternoon, everybody. Today's our briefing for August the 13th. And like we always do, after the briefing and questions, there will be a recap in Spanish. And so thank you all for joining us. Before we get started with the numbers today, I once again just want to thank the community for all your incredible support and compassion, particularly over the last few weeks, and especially this week. I think most folks know that my stepfather passed away on Sunday of earlier this week. So it's been very hard on my brother especially, but on the entire family. Obviously, both my brother and I do feel a bit of comfort knowing that both my stepfather and my mom are together, having both passed, and knowing that the resolution to his stay at the hospital, which had been a month on the ventilator, brings us some comfort. Of course, it's hard to lose both two members of your family and parents, but we also know, and one thing we learned from both of them, and that I learned from them, is to be strong, get to work. We have a lot to do in the city to keep people safe, and being mayor is something I committed to in the good times and the bad. And so here we are doing the best we can to support everyone in our community. I want to also note and thank all the nurses and doctors who are so heroic in taking care of my family, and to all of you to please stay safe and keep your family safe as well. I want to transition now to the numbers of where we are today. As of today, we've had 9,425 residents test positive for COVID. We've lost 188 individuals. Each single person has a family like myself who is mourning their loss. I want to go over today, we're going to go over a little bit of a health update and go over some data. There is some good news in that data. We've got to stay vigilant, but I want to go over that as well. And I also want to note that you probably heard from our health director earlier in the week that the state had some of their data was still lagging in the reporting, and they had some technical issues. Most of that, we believe, has been resolved. The state's reporting system has been fixed from a tech feature, but we're still making sure that all of those numbers are in place. So we're feeling pretty good where the data is, but there still might be some adjustments that are being made in counties across the state. Our positivity rate as of today is about 8.6%. Now, if we remember, about a month ago or so, we were at a peak at about 15%. We went down to 14 to 13 to 10, and now we're at 8.6. Now, that number might fluctuate some dependent on the remaining cases that still need to be logged from the state, possibly. But the overall trend, regardless of the changes that come down from the state, are headed in the right direction. And so the fact that our positivity rate continues to decrease, we know that the state has kind of an 8% goal for an extended period of time where they really believe counties and cities are making progress. So we are doing really well there. But we also know that to really take on community transmission and to ensure that we're not spreading COVID-19, that number needs to go obviously lower than 8%. And we're talking something closer, probably 5%, to really have this virus under control. And that's something that Kelly Colopy, our health department director, can talk more about if there's questions about that. But let's go ahead and review our cases. This first slide indicates our cases by episode date. During our last presentation, our case count was about 8,700. Today's at about 9,400. Of course, there's an increase because we always increase. But as you can see, there is some possible progress that is happening in the community, and we're heartened by that. This city has conducted over 160,000 tests. That is an incredible amount of tests. There are tests available in this city now every day. We have cleared a lot of the backlog. I'm really proud of the team for the work they've done. And there are tests available for you to sign up for a test tomorrow or the next day if you have symptoms or if you feel you've been exposed. So we want you to get tested. This next graph is our deaths per 100,000. Long Beach is represented by the light blue line in this slide. Our COVID-19 deaths per 100,000 is below LA County and still above the state rate, but we are, again, glad that as far as our regional partners, we continue to do slightly better. Again, every one of these deaths is tragic, and we still report in Long Beach anywhere from 1 to 3 deaths daily. Want to show you this next slide. This is where we're starting to see some good news, and that's hospitalizations over time. Now, we know that hospitalizations are reported daily, and over time, as we've said multiple times, the numbers change, and in fact, hospitalizations can increase over time because of reporting and a lag of reporting. But if you can see, there's some good news here. We're seeing slightly fewer hospitalizations. The average number of daily hospitalizations for the last 28 days was 82.9. However, if we look at the last 14 days, the average number was 77.9. So that is telling us that there is no spike. There is definitely a flattening out, and there is a possibility that we are looking now at seeing a decrease in hospitalizations. We hope this trend continues. We definitely need more data to see. But again, this reflects what we're seeing as it relates to positivity rate and other data that we're seeing. And you see, again, this data play out in the hospital data. In this slide, you see that our hospital bed usage is about 55%. If you can remember, at one point, this was at 60%, and then was about 58%, 56%. What the 55% number tells us is that there is room and capacity in our hospitals for patients that are experiencing COVID-19 and need hospitalization. Our hospital surge beds, we would keep those in place. We are not in any way going to eliminate that surge capacity in case we need it. We still have our beds set up at the convention center, and our ventilator use is at 45%. Now, that's slightly higher than it's been in the past, but there are plenty of ventilators that are available for the community. I want to also just note from a PPE perspective, we have nearly 1.6 million units of PPE in our inventory. We have distributed 580,000 units of PPE ourselves and through our state partners. And we put out PPE to local Long Beach nonprofits. We put out local PPE to clinics. We put out PPE to nursing homes, retirement homes. We partner with our hospitals. So your city is working actively to put out PPE all across the community. And this leads me to my next point of discussion, was PPE available for local businesses. Our health orders require folks to wear masks or face coverings, of course, when they go into businesses, people that are working. And through a multi-agency effort, 5,000 employees in Long Beach-based businesses can receive free PPE now, face shields and hand sanitizer. Businesses can request these. We put this information out. They can just call 570-4BIZ or go to the city's website, longbeach.gov/4biz, and we're able to get you that information. And we want to thank all of our California agency partners, the governor's office, the Office of Emergency Services, the Small Business Office, all of our partners for this work. Also want to note that we are opening more and more streets. Pine Avenue will soon be open just for pedestrians. We'll be closing vehicle traffic as part of our open streets plan from Pine Avenue from 1st to 3rd Street. And this is to help those restaurants and businesses survive. We need to ensure that there are places for our workers, for the investments our business owners have made, and for all of us to return to when things get back to normal. So please, if you can safely support our small businesses, please do so. Our health director is going to talk much about our K-12 schools reopening process. I want to just note that there is probably nothing more important for us as a country than getting right how and when schools get reopened safely. It is not safe to do so right now. We know that. We have to have virtual learning. I support that. But at some point in the future, when kids get back to the classroom, whenever that is, doing that safely to protect kids and teachers and parents are going to be critical. And I do want to thank all of the folks out there working on this challenge. Obviously, Long Beach Unified School District, to all the teachers that are out there that have reached out to me, that I've talked to, thank you for being so committed to teaching, our students and our kids. And we promise you, we're working, and our health department is working to ensure that all of you also can stay safe in your environment as you teach as well. And so thank you for your commitment, and that work continues. Want to also just note that the budget, of course, is moving forward. The City Council is discussing the budget. And for anyone that wants to get involved in the budget process, we encourage you to go to longbeach.gov, and all of the community meetings are posted, how you can get involved and give us feedback. As I close, I want to thank the Long Beach City Council. This last Tuesday night, they passed our Racial Equity and Reconciliation Initiative. This is a report of over 100 recommendations on how us as a city can really break down structural racism, can lift up equity, can strive for justice for all people in our community. And that report was put together after weeks and weeks of community meetings, listening sessions, staff work, work by the Long Beach City Council, our health department, so many others. We are committed to justice for all. And in this moment, we know Black Lives Matter, and we have to always strive to do more to ensure that we're centering those in our community that need our support and that need for us to be good allies in that work. And so with that, I'm going to turn this over to Kelly Colopy, who is our Director of Health. I have to head out. She'll be doing our questions today. I have to head out to take care of family responsibility. But thank you again, and we'll be back next week with a further update. So let me turn this over to Kelly.
Thank you, Mayor. Good afternoon, everybody. Happy Thursday. As usual, I'm going to start off with our overview about our stability indicators. So when we're doing our data focus and our daily focuses at the health department and across the city, we focus on our stability indicators. So we continue to meet, as the slide shows, we continue to meet 4 of the 6 stability indicators. The state requests a positivity rate of under 8% over 7 days and a case rate of less than 100 per 100,000 residents. Even with the underreporting the data, we do not meet these numbers. Our 14-day case rate is now 247 per 100,000, which is far lower than it was. It was up in the high 300s, so those numbers are coming down. But they still continue to be over the 100 per 100,000 number that is required at the state level. The positivity rate remains above 8%, but you can see through this graph that we have good news. You just see this downward trend that the mayor was talking about. So as of yesterday, our positivity rate was 8.6%, and at its highest, it was up around 16%. However, 8.6% is also still higher than what is required by the state under the stability criteria that's necessary for us to be able to loosen restrictions. It is an indication of our current efforts that we are making an impact, and it underscores the need for us to keep up the healthy behaviors that we talk about here each week. We're also seeing a slight uptick in our utilization of ICU beds. So we've been at about in the mid-50s for ICU bed utilization. We're now at 64%. So it continues to be below the rate. The state sets an 80% number as a stability indicator. So we continue to be well below that, but the numbers are up a little bit in our ICU bed utilization. In addition, you'll see in our next chart that hospitalizations among community are continue to be up. So the blue line is your community line, and the orange line is the long-term care facility line. For early in our COVID pandemic, we saw far more people from long-term care facilities than we did from our community. At this time, that has switched, and so 59% of our hospitalizations are coming from community members, and that's been sort of moving up since earlier in July. So we do, I want people to understand that, that it is in the community and that people in our community are being hospitalized at various levels of underlying health condition. People who would never think that you would be hospitalized, you're finding that they're being hospitalized as well. So these indicators overall help us understand where we are with the virus locally and really are guiding our decisions in the work that we're doing. So I want to move now to the school reopening guidelines. we've received a lot of questions about school reopening. So a lot of parents reaching out, the school is reaching out, everybody wants to know about what's going on with schools, and I understand it. It's difficult to educate at home for many, and it's also concerning to be back in the classroom, as you're seeing in places like Georgia and Florida, just so many cases coming out when people are going back to school. So I want to share a little bit about where we stand here. Our Long Beach data, because our Long Beach data do not yet meet the stability criteria, and LA County is still on the state's monitoring list, K through 12 schools in Long Beach cannot yet reopen for in-person instruction. So beginning this year, everything will be online. This will go until at least October 5th, and until we are off the monitoring list for 14 consecutive days, which is the current criteria set by the state. So as you know, so we're still off. We still have two numbers that are much higher, and so I just want to make sure that we're paying attention to those numbers. In order to assist all of our Long Beach schools to prepare for eventual reopenings, we're amending our Safer at Home health order and have developed reopening protocols for K through 12 schools for when campuses are allowed to welcome students back. The protocol is based on CDC guidelines, State of California guidelines, and of course our team here at the Long Beach Health Department, supported by science and public health expertise. The protocol is in place not just to keep students safe, but it's also very essential to keep our teachers, staff, and families of our students safe as much as possible. While I won't get into the full content, I'd like to share a few details of what this covers. So the protocol has 5 key areas that must be addressed by each school site. Workplace policies and practices to protect employee and student health. So each school is required to have a COVID-19 exposure management plan that describes the school's comprehensive approach to preventing and containing the spread of COVID-19 on campus. Each school must create a cohorting plan that includes steps that will be taken immediately upon notification of school officials that any member of a school community tests positive for or has symptoms consistent with COVID-19. When we talk about a cohorting plan, that means that you keep a certain number of students and one teacher together and that they don't cross over with other students. So if there is a case, then only a small number of people have the possibility of exposure. Each school must have a testing plan as well for incorporating COVID testing into regular school operations of their school personnel. The second key area is the ability to measures to ensure physical distancing by staff, students, and volunteers. This includes on school buses, upon arrival and dismissal, during the school day within classrooms, and moving in the school buildings during school meals, in administrative and support service spaces, and all the extracurricular activities. The third measures includes measures to ensure infection control on campus. This includes enforcing health screenings when anyone enters the site, promoting optimal ventilation within the school, ensuring appropriate cleaning and disinfecting of space, surfaces, and objects throughout the school, ensuring use of appropriate face coverings at all times, and allowing for frequent opportunities to wash or sanitize hands. The fourth key area is communication with employees, students, and families of students and the public. This includes making sure all are aware of the protocols and school policies regarding return to school and in-person learning, and that protocols are posted at the public entrances throughout the campus. Develop a communication plan in case full or partial closure is required due to a possible cluster of COVID-19 cases, and making sure that all online outlets of the school provide similar up-to-date and clear information. And finally, the fifth segment are measures to ensure equitable access to critical services. This includes each school site developing a plan for updating individualized education plans, or your IEPs, and 504 plans of students with special needs to ensure that education can continue without undue risk to the student, and moving any administrative services or operations that can be offered remotely online. Both the reopening protocol and exposure management plan guidelines will be posted on the city's website very soon for people to review if you're interested in what all the different parts are. Keeping our students, families, and entire community as safe as possible continues to be our main priority. For schools to begin to reopen, it will take all of us across the city following the Safer at Home order to slow the spread of this virus. So I also wanted to share a little more about our testing. Testing is still available, and we have appointments available every day. Along with our state partners, we can do, on average, 1,400 tests per day in the city, not including testing available through your healthcare providers and other private resources. Monday through Friday, we're at Vet Stadium from 10 to 1 and 3 to 5. Monday through Friday, you can also go to the Long Beach Community College Pacific Coast campus from 10 till 1. On the weekends, Saturdays and Sundays, you can get tested at Cabrillo High School from 10 to 1 and 3 to 5. Remember, appointments are always required, but the same-day appointments are generally available at this time. You can make them through our COVID website, which is www.longbeach.gov/COVID-19, or by calling our info line at 562-570-INFO or 570-4636. Residents of Long Beach, Signal Hill, Lakewood, Compton, and Paramount are welcome to test in Long Beach. And if you feel you have COVID-19 symptoms, you can be tested without an appointment at our rapid assessment clinic, which is at the Long Beach Community College Pacific Coast campus, Monday through Friday from 10 till 1. Our website also has information on other testing options available locally, such as testing in North Long Beach at the Jordan Plus campus, which is operated on a state contract. This is available Monday through Friday from 7 a.m. to 7 p.m. and offers testing for those with symptoms and essential workers without symptoms. So with that, I'm open for questions.
Thank you, Kelly. We have a couple of questions from the media for you. First question comes from Haley from the Press Telegram. Go ahead, Haley. Haley, are you there? Okay, we're going to move on over to Valerie from the Long Beach Post. Valerie, go ahead. Sounds like we're not getting input right now. Just wait one moment. Okay, we're going to go ahead and move on to Spanish translation, and if sound comes back on, we will circle back with questions.
Thank you for that, Kelly. All right. Buenas tardes. Hoy es nuestro comunicado de prensa para hoy jueves 13 de agosto del 2020. Vamos a empezar con datos generales. Hasta el día de hoy, 9,425 residentes han dado positivo por COVID-19. Además, aproximadamente 8,072 personas se han recuperado y hemos perdido 188 residentes de Long Beach a causa de COVID-19. De estas muertes, 127 se han asociado con centros de atención a largo plazo. Vamos a hablar un poco sobre la actualización de datos de salud. La semana pasada compartimos información sobre el problema con el sistema de informes del Estado que resultó en datos atrasados. Se han resuelto los problemas técnicos iniciales en el Estado. Seguimos teniendo algunos problemas que estamos trabajando con el Estado para arreglar, pero pudimos borrar todos los casos en la lista a partir de este fin de semana y se reflejan en nuestros datos de hoy. Y nuestro equipo en el Departamento de Salud ha revisado los datos reportados que han ingresado y ahora estamos actualizados. La primera imagen que fue mostrada mostró los casos de COVID-19 por fecha de episodio. Durante nuestra última presentación de datos hace una semana, nuestro recuento de casos fue de 8,709 casos. Hoy, nuestro recuento de casos para la ciudad es un total de 9,425 casos, que es un aumento de 716 casos positivos para COVID-19. Con el problema de los datos que mencioné anteriormente, estamos viendo un aumento en estos números y hasta la fecha la ciudad ha ofrecido más de 160,000 pruebas para el virus. La imagen número 2 que fue mostrada era muertes por cada 100,000. Long Beach estaba representada por la línea azul clara y nuestras muertes de COVID-19 por 100,000 están por debajo de la tasa del condado de Los Ángeles, pero desafortunadamente por encima del nivel estatal. Lamentablemente, seguimos viendo aproximadamente de 1 a 3 muertes diariamente. Lamentamos la pérdida de cada uno de los 188 residentes que han fallecido y extendemos nuestros más sentidos pésame a sus familias. La imagen número 3 enseña las hospitalizaciones a lo largo del tiempo. Las hospitalizaciones se informan a diario, pero con el tiempo las cifras cambian a medida que estemos recopilando datos. Como he mencionado anteriormente, tenemos a residentes que quizás estén recibiendo atención médica fuera de la ciudad y mientras que llegan esos datos vamos cambiando los números o los totales por día, quizás de la semana pasada o ayer. Como pueden ver, hay buenas noticias aquí. Estamos viendo un poco menos de hospitalizaciones. El promedio de hospitalizaciones diaria durante los últimos 28 días fue de 82.9 personas. Sin embargo, si miramos los últimos 14 días, el promedio ha bajado a 77.9. Tenemos la esperanza de que esa tendencia continúe y veremos cada vez menos personas contraer el virus COVID-19 y desarrollar una infección grave. La imagen número 4 que fue mostrada era datos de hospitales en Long Beach. Nuestra capacidad hospitalaria continúa siendo estable y adecuada. Nuestro uso de camillas es del 55%, lo que significa que seguimos teniendo espacio para pacientes siempre que observemos un aumento de personas con enfermedades graves que necesitan ser hospitalizados. Recordemos que personas que necesitan asistencia en el hospital no es solo sobre el virus COVID-19, sino las emergencias que normalmente vemos a diario. Tenemos 325 camas adicionales disponibles y las 100 camas en el centro de convenciones aquí de Long Beach. También seguimos teniendo un número suficiente de ventiladores para satisfacer la demanda actual y futura. Ahorita tenemos el 45% de los ventiladores en uso. Además, tenemos más de 1.6 millones de unidades de equipo de protección personal en el inventario y hemos distribuido más de 581,000 unidades de equipo de protección, lo que me lleva a el siguiente punto. Vamos a hablar un poco sobre los equipos de protección personal que van a estar disponibles para negocios en Long Beach. Como algunos de ustedes ya sabrán, las órdenes de salud requieren que ciertos empleados que trabajan con el público, incluyendo los meseros de restaurantes, usen tanto una cubierta facial como una careta para maximizar la protección tanto para ellos como los clientes. Tenemos buenas noticias para negocios y organizaciones sin fines de lucro. A través de un esfuerzo de varias agencias, 5,000 empleados en negocios van a poder recibir cubiertas, protectores faciales y desinfectantes para mano gratis. Las empresas y negocios sin fines de lucro pueden solicitar paquetes de equipos de protección personal para sus empleados llamando a la línea directa comercial de la ciudad, que es área 562-570-4249 o visitando el sitio de web de la ciudad longbeach.gov/4B y Z para completar ese formulario de solicitud en línea. Recordamos que este es un iniciativo multiagencia que incluye la Oficina de Servicios de Emergencia de California, la Oficina del Defensor de Pequeñas Empresas de California, Pacific Gateway, la Oficina del Gobernador, entre otras agencias. Vamos a hablar ahora sobre el programa Calles Abiertas. Estamos abriendo más y más calles. Ahora vamos a hablar un poco sobre Pine Avenue. Como parte de nuestra iniciativa de Calles Abiertas, la ciudad cerrará una parte del centro de Pine Avenue al tráfico de vehículos a partir del mañana a mediodía. Este espacio permitirá un mayor espacio al aire libre para cenar y para otros servicios selectos, ofreciendo una forma físicamente distanciada de visitar sus restaurantes y negocios favoritos. También permite que los restaurantes y las empresas prosperen durante este momento difícil. La primera fase del cierre es en la Pine, entre las calles la primera y tercera. Si puede apoyar seguramente a esos negocios, se les agradece. Vamos a hablar ahora sobre las escuelas y la reapertura de las escuelas de kinder a 12 grado, dado que el condado de Los Ángeles todavía está en la lista de monitoreo y nos alineamos con el condado. Las escuelas desde kinder a 12 grado en Long Beach aún no están autorizadas para reabrir. Queremos brindar a las escuelas una herramienta de planificación para que tengan tiempo de planificar la reapertura con éxito. Voy a hablar un poco más sobre esto en un momento. También queremos dar las gracias a todos los maestros por su dedicación. Ahorita en un momento voy a hablar un poco más en detalle sobre la reapertura de escuelas, pero ahorita vamos a hablar sobre la reunión de presupuesto comunitario que se dará esta noche. Queremos recordarles que la primera reunión de presupuesto comunitaria será esta noche a las 7 de la noche vía Zoom. Se ofrecerá en inglés y en español. Si no pueden asistir hoy, va a haber juntas en el futuro que serán el 20, 24 y 26 de agosto. Puede visitar nuestra página de web de la ciudad para más detalles. La directora del Departamento de Salud, Kelly Colopi, dio más información sobre el sistema de datos del Estado. Como mencioné la semana pasada, el Estado de California descubrió un subregistro de casos de COVID-19 debido a problemas técnicos con el sistema de informes del laboratorio electrónico que informa al sistema de registros del Estado, CalReady. CalReady recopila datos sobre muchas enfermedades transmisibles, no nomás COVID-19, también incluye enfermedades de transmisión sexual. Y continuamos trabajando con el Estado para asegurarnos de que estamos recibiendo todos nuestros datos sobre enfermedades transmisibles de manera oportuna. Voy a empezar ahora con nuestra descripción general de datos, revisando los indicadores de estabilidad, que es lo que el Estado está rastreando para la lista de monitoreo. Y hay seis diferentes indicadores que estamos viendo. De los 6, seguimos cumpliendo con 4 de los indicadores de estabilidad. El Estado solicita una tasa de positividad de menos de 8% durante 7 días y una tasa de casos de menos de 100 por cada 100,000 residentes. Incluso con un subregistro de datos no cumplimos con estos números. Nuestra tasa de casos de 14 días es ahorita de 247 personas por cada 100,000. Ciertamente ha disminuido. Estábamos en un punto a 347 casos. Ahora ha bajado a 247 por cada 100,000, pero sigue siendo mucho más alto de los 100 por cada 100,000 que está pidiendo el Estado. La tasa de positividad se mantiene por encima del 8% también. Ahorita estamos al 8.6%. La buena noticia es que nuestra tasa de positividad parece estar disminuyendo. Nuestra tasa de positividad a partir de ayer, como mencioné, está al 8.6%, que es mucho más baja que a principios de julio, cuando estábamos viendo una tasa mucho más alta del 16.2%. Sin embargo, el 8.6% sigue siendo más alto de lo que está pidiendo el Estado, de menos de 8%. Aproximadamente el 64% de nuestras camas de UCI, de servicios intensivos, se está utilizando actualmente. Es más alto de lo que ha sido, pero menos del 80% que está requerido para la lista de monitoreo. Entonces, sí estamos bien en ese porcentaje. Además, seguimos viendo más hospitalizaciones entre los casos de la comunidad. Actualmente, más del 60% de nuestras hospitalizaciones provienen de nuestros casos comunitarios frente a nuestras instalaciones de atención a largo plazo. Recuerden que anteriormente la mayoría de los casos de COVID-19 los estábamos viendo en esos centros de atención a largo plazo. Ahora la mayoría viene de la comunidad. Este aumento constante de casos de hospitalizaciones en la comunidad es una tendencia que estamos viendo y observando desde junio. La guía para reabrir las escuelas. Debido a que nuestros criterios de datos de Long Beach no están cumpliendo y el condado de Los Ángeles todavía está en esa lista de monitoreo del estado, las escuelas, todas las escuelas públicas y privadas que de kinder a 12 grado en Long Beach aún no pueden reabrir para recibir instrucción en persona. Todo tendrá que ser en línea. A partir de ahora, el Distrito Escolar de Long Beach comenzará con el aprendizaje remoto solo a partir del 1 de septiembre hasta por lo menos el 5 de octubre. O hasta que estemos fuera de la lista de monitoreo durante 14 días consecutivos. Esto es el criterio actual del estado. Entonces, repito eso, que por lo menos hasta el 5 de octubre los estudiantes tendrán que recibir su educación por computadora y para poder salir de eso tendremos que estar fuera de esa lista por lo menos 14 días consecutivos. Esto, otra vez, vamos a recordar a la comunidad, a aquellos padres, que para poder salir de eso tenemos que seguir con la orden de salud más seguro en casa y no tener reuniones de cualquiera, ni con familiares que no son parte de nuestro hogar y viven con nosotros. Con el fin de ayudar a todas nuestras escuelas de Long Beach a prepararse para la reapertura, estamos modificando nuestra orden de salud más seguro en casa y hemos desarrollado protocolos de reapertura para escuelas de kinder a 12 grado para cuando los campus puedan dar la bienvenida a aquellos estudiantes. Esto se basa en las pautas de los CDC, las pautas del Estado y, por supuesto, nuestro equipo aquí en el Departamento de Salud de la ciudad de Long Beach. Todo está respaldado por la ciencia y la experiencia en salud pública. Por supuesto, el protocolo está implementado no solo para mantener a los estudiantes seguros, sino para también mantener a nuestros maestros, el personal y las familias lo más seguro posible. Me gustaría compartir solo algunos detalles de lo que esto cubrirá. El protocolo tiene 5 áreas clave que cada escuela debe abordar antes de poder abrir a todos los estudiantes. Número 1, las pólizas y prácticas en lugar de trabajo para proteger la salud de los empleados y estudiantes. Esto se requiere que cada escuela tenga un plan de manejo de exposición al COVID-19 que describa el enfoque integral de la escuela para prevenir y contener la propagación de COVID-19 en el campus. Cada escuela debe crear un plan de cohorte que incluye pasos que se tomarán inmediatamente después de notificar a los funcionarios escolares si cualquier miembro de la comunidad escolar da positivo o tiene síntomas consistentes con COVID-19. El cohorte significa que las clases en persona se tendrán que hacer en grupos más pequeños y esos grupos no se van a mezclar con otros grupos pequeños por si sale un caso positivo, se mantenga en ese cohorte. Cada escuela debe tener un plan de pruebas para incorporar las pruebas en las operaciones escolares regulares de todo el personal escolar. Número 2, medidas para asegurar el distanciamiento físico del personal, estudiantes y también los voluntarios. Esto también va a incluir los autobuses escolares a la llegada y salida de la escuela, durante el día escolar dentro de las aulas y traslado en los edificios escolares, durante las comidas y en los espacios de servicios administrativos y de apoyo y en las actividades extracurriculares. Número 3, medidas para garantizar el control de infecciones en el campus. Esto incluye hacer cumplir los exámenes de salud cuando alguien ingresa al sitio, promover una ventilación óptima dentro de la escuela, garantizar la limpieza y desinfección adecuada de cada espacio, las superficies y los objetos en toda la escuela, garantizar el uso de cubiertas faciales adecuadas en todo momento y permitir oportunidades frecuentes para lavar y desinfectar las manos. Número 4, comunicación con empleados, estudiantes y familias de estudiantes y también el público. Esto incluye asegurarse de que todos conozcan los protocolos y pólizas escolares con respecto al ingreso a la escuela, que los protocolos estén públicos en el campus. Y también número 5, medidas para asegurar un acceso equitativo a los servicios críticos, que también vamos a asegurar que todos aquellos estudiantes que requieran de servicios especiales estén también tomados en cuenta. El protocolo también estará disponible en nuestro sitio de web esta semana. Lo más importante para nosotros es mantener a nuestros niños seguros, familias y maestros seguros. Esta sigue siendo nuestra prioridad. Y como mencionó el alcalde, le damos gracias a todas las maestras por toda su dedicación ahorita en este momento. Vamos a hablar ahora sobre las pruebas que todavía están disponibles en la ciudad de Long Beach. Me gustaría recordarles a todos que las pruebas de COVID-19 están disponibles todos los días de la semana aquí en Long Beach y que hay citas disponibles. Voy a hablar sobre los locales que requieren cita y también aquellos que están disponibles para cita el mismo día para aquellas personas que tengan síntomas. Junto con nuestros socios estatales, podemos hacer en promedio alrededor de 1,400 pruebas diarias en la ciudad, sin incluir las pruebas disponibles a través de su proveedor de atención médica. Como habíamos informado el mes pasado, cada sitio médico también, cada local médico también tiene que ofrecer la prueba de COVID-19. De lunes a viernes estamos con las pruebas disponibles en Vet Stadium de 10 a 1 y de 3 a 5 de la tarde. De lunes a viernes puede ir al campus del Colegio de Long Beach en la esquina de Orange y Pacific Coast Highway de 10 de la mañana a 1 de la tarde. Los fines de semana, sábados y domingos, puede hacerse la prueba en Cabrillo High School de 10 a 1 y 3 a 5 de la tarde. Recuerde, las citas sí son obligatorias, pero generalmente ha habido citas disponibles para ese mismo día o al día siguiente. Puede hacerlo a través de nuestro sitio de web en longbeach.gov/obicua COVID-19 COVID-19 o llamando a nuestra línea de información al área 562-570-4636. Los residentes de Long Beach, Signal Hill, Lakewood, Compton y Paramount son bienvenidos para tomar pruebas aquí en la ciudad de Long Beach. Si siente que tiene síntomas de COVID-19, también puede hacerse la prueba sin una cita en el Centro de Evaluación Rápida en el Colegio de Long Beach, en la localidad que acabo de mencionar anteriormente por la Pacific Coast Highway y Orange. De lunes a viernes, usted puede ir sin cita de 10 de la mañana a 1 de la tarde. Nuestro sitio web también tiene información sobre otras opciones de pruebas disponibles localmente, que incluye localidades en el norte de Long Beach, en el campus de Jordan Plus. Ellos ofrecen pruebas de 7 de la mañana a 7 de la tarde. Ellos ofrecen pruebas para personas, déjenme aclarar que Jordan Plus ofrece pruebas para personas con síntomas y trabajadores esenciales que no tienen síntomas. Eso es todo por hoy. Gracias por acompañarnos. Vamos a seguir con preguntas. Tuvimos un poco de problemas con las preguntas y vamos a seguir con eso. We are now going to continue with the questions. We had a little bit of technical issues and we are now back. Kelly will now be answering some of those questions from the media and public. Thank you so much.
Thank you so much. Kelly, we have a couple questions from the media for you. First one comes from Haley at the Press Telegram. Since our indicators are headed in the right direction, is it possible that Long Beach schools could reopen faster than other districts in LA County?
So at this time, in terms of the monitoring list, so as long as LA County is on the monitoring list, we're on the monitoring list with them, no matter what our data say. So our K through 12 schools will require that all of LA County is off the monitoring list for 2 weeks. There may be opportunities in the future where there will be the ability for K through 6 grades to be able to open sooner than that, but we will be watching our data and determining if there's a mechanism that we would move forward.
Thank you, Kelly. Next question comes from Valerie at the Long Beach Post. Is there any data available about where people are getting infected?
Yeah, so, as we do interviews of folks to understand, where they've been and how they believe they were exposed, and also to be able to let people know that they've been around, that they've been exposed, and to follow the quarantine practices. Many of those who have positive cases have been exposed with their friends and their families, and at gatherings that are occurring in backyards and people's homes, and others because there's this feeling of safety. But we are finding that people are not super excited to let us know who they've been around because they feel like those folks will possibly get in trouble. So everybody knows they're not supposed to be gathering except that it is happening. And so we want to make sure that we're here to be able to stop the spread of the disease. So if we're asking you for your contacts, we ask you to please provide them so that we can ensure that people can be as safe as possible and that people are isolating and quarantining. But these are coming from gatherings, far less than they're coming from businesses.
Thank you, Kelly. That concludes questions for today. Thank you, everyone, for joining us.
Thank you.